Our last speaker is Heba Abdelnabi, our transplant dietitian. She's certified diabetic care educator specialist with masters in nutrition. Prior to joining the transplant division, she worked at SUNY as a dietitian with a outpatient hemodialysis center. She will be speaking on cardiac health post-transplant, starting with a guest presentation. She will place emphasis on what she has been very passionate about, and that is heart-healthy diet. I would like to invite Heba to the podium.
Hi, everyone. Thank you, Dr. Naji, for the introduction, and thank you so much, Dr. Roshan and Dr. Markel, for inviting me to speak at today's symposium. So in this presentation, I will discuss a heart-healthy diet post-transplant. And after a kidney transplant, diet is very important for your healing and better general health. A heart-healthy diet is recommended to reduce elevated blood cholesterol levels, manage high blood pressure, and lower risk for heart disease. So before I discuss what a heart-healthy diet entails, I do want to talk about the role of a transplant dietitian in post-transplant care. So the role of what I do, I provide medical nutrition therapy with various nutritional issues, including significant weight gain, malnutrition, electrolyte abnormalities regarding potassium, phosphorus, magnesium, for examples, diabetes and blood sugar management, whether patients already have a history of diabetes or new onset diabetes. I also go over elevated blood pressure, elevated lipid levels. And so new kidney transplant patients are on referral based on a score of at least 2 in the malnutrition screening tool, and MD consult will be assessed within 48 hours of admission, while any other active kidney transplant patients will be assessed within 5 days of admission. In post-transplantation care, I'm available as needed, and that can be by referral by any member of the transplant team, or if the patient requests that they want to see the transplant dietitian. So as needed, I can be in the outpatient clinic, or if the patient wants to speak to me over the phone, that is fine as well. And then I document the visit in the electronic medical record. Okay. I have no disclosures relative to the content that I am presenting. So by the end of this presentation, all of you will be able to express at least 3 tips for choosing heart-healthy fats, identify at least 2 ways for choosing heart-healthy carbohydrates, and determine at least 3 tips for reducing sodium. So I do want to go over a case that I've encountered and I've educated her as well as her family about regarding a heart-healthy diet. So this was a 78-year-old female who was seen in the clinic and admitted in inpatient post-kidney transplant. Her past medical history includes end-stage renal disease, status post-transplant on September 27th, 2022, wound infection completed on antibiotics, latent tuberculosis, hypertension, diabetes, hypothyroidism, and hyperparathyroidism. So her labs 3 months after transplant showed above target triglycerides, as well as above target LDL cholesterol. And sometimes I tell my patients, I identify LDL cholesterol as the bad cholesterol. And her HDL cholesterol was below target. So I took this as an opportunity to educate and counsel the patient and her family on heart-healthy eating habits and creating a healthful food environment in the household. I was also able to follow up with her on several visits and evaluate the patient's understanding of what a heart-healthy diet consists of, and just, assess her understanding. and if she has any nutrition questions. Okay, so high LDL cholesterol levels are a risk factor for heart disease. However, did you know that dietary cholesterol itself doesn't contribute to increases in your body's blood cholesterol? And this is always a learning opportunity to my patients, because a lot of them have been told that, eggs, for example, they can't eat it or they just need to avoid it because it is high in cholesterol, where surely, they're eating other foods that's probably causing their cholesterol to spike up further rather than eggs. So cholesterol, dietary cholesterol itself is not really related to the body's blood cholesterol. The biggest influence on blood cholesterol level would be the mix of fats and carbohydrates in one's diet, and it's not the amount of cholesterol one eats from food. So although it remains important to limit the amount of cholesterol you eat, for most people, dietary cholesterol is not as problematic as once believed, and there is no significant link between the cholesterol one eats and his or her risk of heart disease. So I go over, the first objective, and which is several tips for choosing heart-healthy fats. So the first one is choosing lean protein and low-fat dairy foods to reduce saturated fat intake. Saturated fat is usually found in animal-based protein, and it is related to certain health risks. It is the biggest contributor to raised LDL cholesterol levels in diet, and research shows that limiting saturated fat lowers unhealthy cholesterol levels. We also want to avoid trans fats, and trans fats increase levels of LDL cholesterol. So for those who are not familiar with trans fats, most trans fats are formed through an industrial process where hydrogen is added to vegetable oil to make it solid at room temperature, and therefore stable, shelf stable. Hydrogenated fat in processed foods, it is the main source of trans fats in foods, and trans fats can be found in stick margarine, shortening, processed sweets, baked goods, some fried foods, and packaged foods made with hydrogenated oils. So we want to avoid foods with partially hydrogenated oil on the ingredient list, and that can be found in cookies, pastries, baked goods, biscuits, crackers, microwave popcorn, and frozen dinners. Now, this is also another learning opportunity where I tell my patients that just because a product contains 0 trans fat, it doesn't necessarily mean that the product does not have trans fat. So always make sure to look at the ingredient list to see if it has partially hydrogenated oil on the ingredient list. And we want to eat foods with heart-healthy fats, including polyunsaturated and monounsaturated fat. There are types of unsaturated fats that may help lower blood cholesterol level when used in place of saturated fat in the diet. So some examples of polyunsaturated fat could be fatty fish like tuna, salmon, mackerel, and some sources of monounsaturated fat could be olive oil, peanuts, cashews. This is a table. Well, I give a handout after I educate and counsel the patient about, but this table is in the handout, and it's basically preferred foods or healthier recommendations. And I don't do an, all-in-one approach where I tell them, you have to avoid this food completely, but just, healthier options on a regular basis to help lower your cholesterol levels. So I'll just give a few examples. Instead of coconut oil, palm oil, a healthier recommendation would be liquid vegetable oils such as corn, canola, olive, soybean, and safflower oils. Instead of fatty marbled beef and pork, choose lean beef and pork. If you're buying meat at a supermarket, make sure it's 85% or more lean in packaged labels. If you're getting meat through a butcher, just, communicate with the butcher to make sure it's lean. Poultry with skin instead of poultry with skin, choose poultry without skin. And also making sure that the skin or the fat of poultry, such as chicken, turkey, duck, are removed before cooking, not right before you eat. Okay, so let's brainstorm. Which has more fiber, quinoa or white rice? Yes. So the right answer is quinoa. Quinoa is classified as a whole grain, and whole grains contain more fiber than refined grains such as white rice. The next thing I go over regarding a heart healthy diet is a few ways for choosing heart healthy carbohydrates. As you may all know, not all carbohydrates are equal. Even though carbohydrates provide us with energy, some we just need to limit in portions. So regularly, I recommend to consume foods rich in soluble or viscous fiber. And soluble fiber is found only in plant-based foods. Animal-based foods like meat and dairy do not have fiber. In the stomach, soluble fibers absorb water and swell to form a thick jelly-like mass. Fiber helps to reduce the risk of heart disease and lower cholesterol by removing it from the body. And rich sources of soluble fiber include whole grains, asparagus, Brussels sprouts, oranges, legumes, barley, oats, oat bran, and quinoa. And I definitely emphasize to patients, because before they were on, renal diet restrictions, now it's more liberalized. I do also emphasize that to eat more plant-based foods, such as beans, nuts, tofu, seeds, peas, to also get their nutrients like protein. We want to limit refined carbohydrates. So refined carbohydrates are foods with high amounts of simple sugars that can raise triglyceride levels. High triglyceride levels are associated with coronary heart disease. And some examples of refined carbohydrate foods to limit are table sugar, sweets, and beverages sweetened with added sugar. So let's answer another brainstorming question. What is the recommended sodium intake per day? Now, there are different guidelines that recommend different sodium intake based on different conditions, but the one I'm looking for is based on the dietary guidelines for Americans. Does anyone want to venture a guess? So for the dietary guidelines for Americans, they recommend adults should not exceed sodium intake to 2,300 milligrams per day. However, for people with blood pressure, we do want to limit it to less than 2,000 milligrams. And a single teaspoon of table salt has 2,300 milligrams of sodium. Next, I go over tips for reducing sodium. And although sodium is important for your body to function, too much sodium can be harmful for people with high blood pressure. As sodium and fluid build up in your tissues and bloodstream, your blood pressure increases, and high blood pressure may cause damage to other organs and increase your risk for a stroke. So we want to avoid processed foods and eat more fresh foods. Fresh fruits and vegetables are naturally low in sodium, as well as frozen vegetables and fruits that have no added juices or sauces. Fresh meats are lower in sodium than processed meats. So processed meats like bacon, sausage, hot dogs, corned beef. I go over with a patient reading a nutrition label, or just asking the butcher to help find a fresh meat that is low in sodium. And be a smart shopper. So look for packages that say salt-free or sodium-free. These items contain less than 5 milligrams of sodium per serving, and also looking for low sodium products that contain less than 140 milligram of sodium per serving. And just because we are limiting salt doesn't mean that our food needs to be bland, because it definitely needs to have some flavor. Downstate does serve a large Caribbean population, and it is important to include in the nutrition education aspect the different spices in their culture to give their dishes a full, rich flavor without adding any salt. So some examples include curry, allspice, commonly known as pimento, ginger, garlic, cinnamon, Scotch bonnet pepper, thyme, scallions, nutmeg, and paprika are all different examples that we can add flavors to our food without adding sodium. I go over the nutrition facts label on several visits, and I know Dr. Markel mentioned in her presentation about health literacy and nutrition literacy. So sometimes sometimes my patients may have a challenging time understanding the nutrition facts label or what to look for. So I always go over that with them. And as you can see in the nutrition facts label, there are 4 servings per container. A serving size is 1 pack, and 1 pack contains 74 milligrams of sodium. And this is a picture of some spices that you can use to flavor your food. Okay, and that brings us to the end. Thank you for your time and attention.
Thank you, Heba. Your presentation was interesting, engaging, and I would say it's an excellent presentation. It's also relevant not just to our patients, but I would say to me too, and maybe to some of us in the audience. Thank you so much. We now come to the end of this session. I don't think, if I'm wrong, Dr. Markel and Dr. Roshan, you let me know. I don't think we may have time for questions. Okay, we can take one question. Before that, I want to say somebody asked a question about the hemoglobin A1C target. During his presentation, Roberto told us that A1C target is 6.5 to 7.5. So I just want to come to that. I don't think we do, but we want their diabetic management to be optimized because it's going to be an issue post-transplant. So what we do is if their diabetes is not controlled, we refer them to endocrinologists, and we want to ensure that it's controlled. But at the same time, we don't want it to be like a barrier. We don't want to delay transplant for a very long period of time because of that. Yes, but we try to send them to the endocrinologist, try and get it controlled.
I just want to remind you also that hemoglobin A1C is a very poor measurement in someone on hemodialysis, that there's some issues having to do with, dialyzability and red blood cell turnover. So it's, you really wouldn't want to, it tends to be higher for a given blood sugar. So you really wouldn't want to, say that somebody couldn't be transplanted based on a hemoglobin A1C. But as Dr. Naji said, we do look at it as, again, sort of a red flag in terms of adherence, and hope that they could go to the endocrinologist for better management.
Thank you, Dr. Markel. And as Dr. Markel said, if you look at the guidelines have various recommendations for A1C. The KDIGO clinical guidelines will recommend A1C of 7 to 7.5 in transplant patients. American Diabetic Association has a recommendation of hemoglobin 7. There was a post-transplant meeting on post-transplant diabetes in 2017. Their A1C recommendation was around 7 to 7.5, but they said that it should be individualized, that you should take into consideration patient comorbidities, cardiovascular disease, and risk of hypoglycemia. You're welcome.